Namaskar. Welcome to Ayushakti's YouTube channel. I am Dr. Smita Naram, founder of Ayushakti, and today with me we have Dr. Tom Mitchell from USA. He is practicing Ayurveda for 20 years in North Carolina, Raleigh, and he is practicing Ayushakti way of Ayurveda for 20 years. He is very successful, and I am very happy that here today we will be sharing our experiences about diabetes. Would you like to share some your clinic experience?
Yes.
Yeah.
Thank you. It's a pleasure to be here. I wanted to share one experience of a patient who came in recently with diabetes. He was actually taking 2 or 3 different allopathic medications for the diabetes, and as you frequently see, the diabetes still was not well controlled. So even though he was taking, he was not on insulin yet, but he was heading in that direction, and his physician told him that unless things improved, he would be on insulin. So I think there's a particular marker, a lab marker, that's called hemoglobin A1C, and it gives a measure of how severe the insulin resistance or the diabetes is. His, I believe, was above 9.
Wow.
When he came in, even though he was taking allopathic.
Normally 6 actually, under 6.
Under 6, yeah. Which means his blood sugar was probably up around 200, which is quite high actually, even though he was on this medication. So we started him on some very specific food and diet recommendations, and also recommended exercise. And over the course of the next 9 months or so, his hemoglobin A1C came down from above 9 to under 7, which if it becomes under 7, according to the allopathic model, it's considered to be under control.
Wow.
So he was still taking his allopathic medication, but he began to exercise as well. And he was very religious about following the food recommendations and about exercise, and so he lost quite a bit of weight also.
Yeah.
So, yeah.
Great. I remember this Raghu whom I met in your, he came to see me in your clinic when I was there in US, and he had also the exactly same situation. I think 9 or something, HbA1c was 9, and his doctor said that you need to increase your dose of allopathic medication, add a few more things, and if it doesn't work, then you may need to go on insulin. And we started with a diet, a specific diet of, I always recommend people to stay on protein and vegetables in the diet, and also diet, be here, exercise, everything. Detox 5 days every month of mung and vegetables only. And in 6 months' time, when I was back to your place again, his HbA1c was 6.5, and he almost cut down his tablets of the doctors. Plus, without treating it, he naturally didn't need any blood pressure medication because that was balanced naturally. So his own doctor said that you don't need this anymore.
Yeah.
And he lost 20 pounds, I think,
Yeah.
in 6 months.
Yeah.
So would you like to share the diet
Yes.
that we do?
Yes. So as Dr. Smita was saying, it's very important to essentially avoid carbohydrates as much as possible. So what works very well is to be on a diet of protein and vegetables. So if you're vegetarian, then you can have things like moong dal or chana dal or chickpeas, for example, vegetarian protein. And then if you're not vegetarian, then it's better to stick with like white chicken meat, white turkey meat, and some fish in terms of protein. And then eat vegetables and avoid the carbohydrates. And if you do have carbohydrates, then the best grains are millet. Is probably the best one because it doesn't have a high glycemic index. It burns very evenly, so it doesn't make the blood sugar come up and down. So that is a possibility, but it's better just to avoid carbohydrates in general.
Yeah, just for the Indian people, I just want to suggest that completely stop rice and wheat from your diet completely, at least. Potatoes and fruits also are carbohydrates, that sometimes taking fruit can spike the sugar very quickly. And instead of that, replace your chapatis. Make your chapatis with besan, the chickpea flour, 75%, just add a little bit of wheat so it can bind it. And that chapati is high protein, so it can help you, because we eat a lot of chapatis in India. And just to replace the chapati with the right thing itself is a big 80% thing done.
Yeah.
That's why, simple
Yes.
suggestion. And of course, and I would always recommend to do a Detox kind of a detox. You have just started a smart detox, which is like 1 week program.
Yes.
That people can completely eliminate these mucousy toxins which block pancreas and create diabetes type 2. So once you remove the blockage, your own insulin actually comes to your blood again, and it works for you now. So it's important to remove the block either through the diet, so 5 days of moong and vegetables, or Detox kind of a detox. You can also take a home remedy of a teaspoonful of turmeric powder, a teaspoonful of Karela, the bitter gourd powder, and a teaspoonful of jamun seed powder mixed together. If you can find amla, also you can add half a teaspoon of amla. Mix it together with half a glass of water and take it 2 or 3 times a day. This can also help to manage the blood sugar level. Thanks for sharing that.